Hello everyone, my name is Robert. I'm a nursing student from Nightingale College. Today I will be performing a video skill, intradermal injections. So for this skill, before I begin this skill I should say, I do have my ID on. I also wearing the school uniform. I have hand sanitizer here, so I'm going to go ahead and start by cleaning my hands. So I am going to first start by checking the physician's orders against the electronic health records, and then from there I'll also check the physician's orders against the medication administration records. And what I'm checking for when I say check, I'm checking for the 6 rights of medication pass. And what that is I'm checking for the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation. Be mindful that the right documentation will come after you pass that medication, right? That's the 6 rights of medication pass. Because everything looks good with the 6 rights with the medication administration records compared to the physician orders. Also, the the electronic health records compared to the physician's orders. I can go ahead and proceed to head to the med card. My hands are clean. I just use the hand sanitizer. I'll head to the med card. I'll pull out the medication, and then I'll go from there. I'll start my safety checks with checking the medication against the medication administration records, right? Got the medication, and there's an order that says for me to give 0.1 milliliter intradermal injection of tuberculin purified protein derivative. For this particular skill, I will not have to do any dosage calculation, considering that the medication that I have on hand is 0.1 medication I have on hand, it is 5 tuberculin units per 0.1 milliliters. I will be using the 1 milliliter 29 gauge syringe, 29 gauge by 0.5 syringe. This is what I have on supply and what was supplied to me. I'll go ahead and put that up a little closer, right? So that's the syringe, right? So we'll go from there. So because everything looks good with the medication against the medication administration records, I'll go ahead and count this as check number 1. As I said, I'll be doing these safety checks at least 3 times, verifying the 6 rights, right? So I'll go ahead and grab my items. I'll head into the patient's room and introduce myself, right? Go into the patient's room, knock, knock. Hello, Mr. Jones. My name is Robert. I am a nursing student from Nightingale College. The reason why I'm here is that there's a physician's orders for you to receive an intradermal injection, right? So before I begin, let me go and put these items down, and I'll go ahead and pull your privacy curtain, and I'll wash my hands. Give me 1 second. I'm placing the items down on a clean, dry surface. Pull the privacy curtain. Shh. Then I'll go ahead and wash my hands. Washing my hands. Hands are clean. Now that my hands are clean, I can go to the patient and ask to see his ID and touch the patient because my hands are clean. So, Mr. Jones, can I please see your ID band? And can you please verbalize your full name and your birthday? Okay, name is Raymond Jones. Birthday, March 10th, 1964. Thank you very much, sir. Now that Mr. Jones has verified his birthday, I'll go ahead and do the second safety check for the medication pass. Right, so I'll go ahead and compare his name, his birthday, to the medication administration record and compare it all to the medication that I have on hand. Okay, everything looks good there. Mr. Jones, do you have any allergies? I'll ask Mr. Jones if you have any allergies to any seasonal allergies, if he has any, is he allergic to any foods, or is he allergic to any medication? Mr. Jones verified and said that he does not have any allergies. I will explain to Mr. Jones that he's going to be receiving a intradermal injection. It's going to be 0.1 milliliters of tuberculin purified protein derivative. I will explain to Mr. Jones that this medication is often prescribed to do a TB skin test in case there's a risk that somebody may have been exposed to tuberculosis. We'll do that TB skin test where the injection will go right up under the skin, and we'll go ahead and go from there. I would also explain to Mr. Jones that this medication, let's see here, this medication may have some side effects to it, meaning that it may cause some itchiness on the site where the injection is given. It may have some swelling on the site where the injection is given. You may even have a rash in that area. I would also explain to Mr. Jones that it's important that if he has any type of side effects, he is to let us know immediately. Also, I would explain to Mr. Jones that there may be some adverse effects from this injection, meaning that if he's having any signs of shortness of breath, if he's having any type of, like, he feels like his heart is beating faster, tachycardia, or if he feels like there's just a rash or anything like that, he is to let us know that is an adverse effect. Also, I would give Mr. Jones a chance to ask any questions that you may have about the medication. No? Okay. So I would explain to Mr. Jones that this medication, or this is going to actually be given right on your arm. Like, usually you can get it like on your back, but we're going to actually do this like on your forearm area, right? And I would explain to Mr. Jones that it would be at least about 3 to 4 fingers away from the antecubital space, which is right here. So 3 to 4, this is the antecubital space, but 3 to 4 fingers down from it, but a full hand's length above the wrist. So it's going to be right in that area here. So, do you have any questions at all about the medication that you're going to be receiving? Okay, Mr. Jones confirmed that he has no questions at all about this medication. Mr. Jones confirmed he has no allergies. So before I even put on my gloves, I'm going to go ahead and do hand hygiene again. Clean my hands. Hands are clean. Okay. All right. Now I can put on the gloves, and I'll go ahead and prep the medication in the meantime. So gloves are on. All right. So what I'm going to do is I brought alcohol wipes because I need to clean the top of the bottle. Okay, let that air dry. And put this in the trash over there. And then for the syringe, with the cap still on, I'm going to draw in or pull in 0.1 milliliters of air. 0.1 milliliters of air. There we go. With the 0.1 milliliters of air, that's what it looks like. Let me turn that syringe so you can see it better. I know it's hard to see. Now, I'm going to remove the cap. And I will now inject 0.1 milliliters of air into the medication bottle. Inject the air. Now invert the bottle and draw in to the syringe. Pull in 0.1 milliliters of tuberculin medication. So let me make sure I got that there. Now I'm going to leave the syringe inside the bottle and tap the bottle because I want to make sure there's no air inside the bottle. Right? So 0.1. Let's make sure that's there. Okay, making sure that's right on 0.1. Good. Okay. All right. Now, because I still have to prep the, there was no air bubbles, by the way. I just said there's no air bubbles on this one. But as I said, leave the syringe inside of the medication bottle. If there is air bubbles and you want to tap to make sure that the air bubbles go back in. If there's too many air bubbles, you'll go ahead and push all the medication back in and then redraw back. Right? But I'm going to recap this because I need to prep the site where I'm going to be giving the injection. So I'm going to go ahead and put this to the one hand scoop. Okay, one hand scoop. Let's put that there on the cap and one hand scoop. There we go. Okay, good. And make sure that's on tight. Put that on. One hand scoop is there. All right, now I need to go ahead and find the site. I explained where that's going to be, right? And that's going to be on the right beneath the antecubital space, on the inner forearm, right there on the forearm. So I'm going to first inspect the area. I'm going to inspect, looking for any signs of any lesions, any rash, or any swelling, or any forms of anything oozing out, any sores, making sure that everything looks good on that part of the skin. Now I'm also going to palpate, lightly palpate. And what I'm feeling for now is I'm checking to make sure there's no skin mass or any mass or any form of tenderness in those areas, right? So what I'm going to do now is I found the spot, and now I'm going to clean that area with alcohol, right? Find the spot that I'm going to use and use a circular motion, 2 centimeters, working my way out in a circular motion, right? That's clean. I'm going to let that dry on its own. Now I'm going to hold the syringe with my index finger and thumb, holding it up, making sure that the bevel is up. And I'm going to, well, this is with my dominant hand. Now with my non-dominant hand, I'm going to actually pull the skin tight. And I'm going to come in at a 5 to 15 degree angle to actually put the syringe into the skin. As I feel some form of resistance, then I'll proceed to go in a little bit more. And with my dominant hand, I'm going to push in the medication, 0.1 milliliter. And there's a little bulb. And I, of course, would explain to the patient before I even poke him that he will feel some type of bite sensation, like a biting sensation, like a little insect bite. It will feel like when it gets poked. And Mr. Jones is going to remind you that that's what you're feeling right now. As I mentioned earlier, if I haven't, that's what I have done. And I'll go ahead and pull out the syringe. And there's a little bulge there. And I'll put the cotton there, cotton swab, just to make sure that this goes into the sharps container first of all. Put that in the sharps container. In case he's bleeding, I won't rub the spot. I'll go ahead and make sure there's no blood. There's no blood. Just to recap real quick. I definitely will find the right time to explain to the patient before he get the injection that he's going to feel like a biting sensation. That would be explained to him usually with the side effects that may come with the actual injection. Right? Just want to throw that out there. Not after the fact, but yeah, just throw that out there. And then so I'll find out, Mr. Jones, are you feeling okay? Good? Okay. I'll give the patient the call light, and I will go ahead and clean up the area, right? Clean up the area, perform hand hygiene, right? Hand hygiene. And then from there, I'll go ahead and document this skill. Thank you very much.